So my name is Kristen Ely, and I've been a nurse here at Rabida for 4 years, and I work on the inpatient unit.
My name is Erica Thomas. I'm a child life specialist, and I've been at Rabida for 13 years.
My name is Carol Usher, and I'm the team leader of the Special Processing Department. I have worked at Rabida for 22 years.
My name is Bristol Garcia. I'm a registered pharmacist. I've been at Rabida for 9 years, and my role here is basically to ensure that the patients get their medications.
My name is Lisa Hudson, and I am the outpatient clinic charge nurse at Rabida Children's Hospital. I help with the flow of the outpatient clinic on a daily basis.
Hi, my name is Marlene Stockner, and I am in environmental service. I've been here for 15 years, and I work on the inpatient unit.
My name is Linda Robinson. I am the manager of the respiratory care department. I've been here for, it will be 3 years in August, yay!
My name is Divya Varian. I'm an occupational therapist, and I've been at Rabida for 8 years.
Hi, I'm Michael Hoba. I'm the medical director of the Burn and Wound Rehab Program at Rabida. I've been here since about 2007.
A typical day at Rabida as an inpatient nurse. During bedside rounds, the nurses from both shifts go in and see the patient together, make sure there's nothing acute that needs to be addressed at that time. We kind of pull together our plan for the day, look up all the tasks that need to be completed, medications, feeds.
A child life specialist at Rabida, we're here to service the social needs of the child. Our goal is to try to normalize their hospital stay as much as possible by including and incorporating things into their daily schedule that they may be doing at home. Like, for instance, we make sure that they have schoolwork, we make sure they have playtime.
What we do in SPD is we issue out all patient supplies to the floor, which includes gowns, bottles, diapers, baby bath, baby lotions, anything, any supply that the patient needs on a daily basis. SPD issues that out to the unit.
Well, my role is basically to collaborate with the physicians, the nurses, to make sure that we optimize the therapy for the patients that are in the hospital and outside the hospital.
As an occupational therapist, I try to work with the rest of the rehab team, including the physical therapist, the speech therapist, and the infant development specialist. We try to look at what the goals of the children are and how we can all work on them together, both focusing on the areas that we are particularly concerned about, but then the overall goals of the child, to look to see what we want for them in the long term.
When I come in, I am first looking at the clinic assignment for the day, and that consists of the physician that's working that day, the number of patients the physicians have scheduled, and I also match that with the specific clinic personnel staff, whether it be the nurse, the medical assistant, or the CNA. I get the clinic equipment ready, making sure that all the equipment we may need for the day. We have diabetic clinics, so we use the A1C machine and the glucometer. We do an asthma clinic, and we have a spirometry machine. So we have a lot of equipment that we use in this department, and we have to make sure it's working to get through the day.
Well, the environmental service department, we play a big role in the hospital because we help keep it sanitized and we help keep it clean. We are all caring, and we are capable, and we are committed to keep this hospital going.
We primarily take care of patients that are having trouble breathing. That could be a breathing machine on the far end. Other things that we do is providing extra oxygen if the patient needs oxygen. We also give nebulizer treatments to patients that need help opening their airways. We suction, which is artificially helping them clear out their lungs. We provide therapies that help mobilize secretion. It's called chest physiotherapy.
My name is Jeff Barkin, and I am Luke's father. Luke is autistic. He was diagnosed with autism at 19 months old, and ever since then he's been autistic, nonverbal. He was burned on January 24th. We were cooking something on the stove, and I went in the other room to get a shirt out of the bathroom, and I was in there and I started smelling something burning, and I thought it was very unusual. And I'm kind of smelling, I'm looking around, and I look down the hall and I see Luke standing there on fire. He didn't Since he can't talk, he wasn't able to communicate that there was something wrong, and he obviously doesn't feel pain the way we do, so he didn't notice and didn't realize he was on fire, and he didn't know what to do. Luke's been in La Rabida for approximately just over 3 months, and it's a great experience for us, as any parent would be nervous leaving their children in a hospital where they don't know and they've never heard of it before. And so having him here long enough, I realized that it's a great place for your children to be, because it's very comforting, because the staff and everyone involved takes such great care of your children, and it's a personal touch. The nurses all know what he needs and likes, and I don't have to worry.
So the care of a serious burn like Luke's requires a multidisciplinary approach. We have a team of occupational physical therapists that are trying to minimize contracture formation, and then we have a psychological therapist who is dealing with this trauma experience of the burn, and then the nursing is very extensive. And so really the experience we've developed over years of caring for burn injuries like this make this a great place for rehab, and where his surgical team wanted him to come as soon as they could get him here.
We have been very involved with his medication therapy. We go on daily rounds, and we make sure that whatever medications he's on, especially the ointments that are used for the burns, we can make sure that that's optimized.
Every day I passed by there and I would say hi to him, and he would look. He loves strawberries and chicken, and I would always see him sitting there eating it, and sometimes he would shake his head. But just looking at Luke, how he has progressed, make me feel so good about our rehab and therapy department.
When he first came here, he was only able to lay in his bed, and he didn't move at all. Now you can see him running around the floors and outside when he goes with the therapist. And so that's a huge change, and his grandmother, who comes here very frequently, is so happy to see that some of the old Luke is coming back.
He seems to really work hard, and he seems to pick up on anything that you give him really quickly, and he's just a joy to work with every day. He just wants more activities all the time, and I just love working with him.
The inpatient nurse's role in Luke's care is to, give him his medications in the morning, change his burn dressings, monitor his burns for any changes or infections that might be occurring, provide palliative care measures, so which means keeping him comfortable, managing his pain and his itching, and keeping him comfortable through dressing changes, monitoring his nutritional intake.
My hope for Luke is that when he leaves La Rabida, he is able to do more of the skills that he was able to do prior to the accident by himself. It would be great to see him get dressed in the morning by himself and be able to be ready for school on his own without having somebody help him do those things.
I'd just like to say thank you to everyone at La Rabida. It's been, like I said, a really, really great experience, and they've made us feel very welcome, and we're very appreciative that Luke was able to be here.
The one thing that I enjoy that makes me always want to come to work is when I see a patient basically from where they started to when they're discharged, like seeing a baby that was crawling when they got here, walking, or a patient that wasn't walking, an older patient who's walking now, or someone that's talking. Patients, we've taught patients to read, so to see them start to read, and to hear patients talk about how much they've enjoyed their time at La Rabida, that is one of the things that really brings me joy.
La Rabida Hospital helps the less fortunate. We have a big heart.
Our patient population, these kids are just so determined and resilient, and just, they're wonderful to work with. And the mission of La Rabida is truly one that I hold true to my heart.
The reason that I really enjoy coming here is because of our interdisciplinary approach to therapy, and that all of us are working on the same goals, and that we're all trying to support the child in attaining those goals.
I can look at a child who is compromised with, be it walking, breathing, mental challenges, and they're happy. They are dealing with their challenge in such a courageous way. It encourages me. So I'm upset about a bill I have to pay or something minor. When I look at them and they're able to handle this challenge with such strength, it encourages me, and it's like, Linda, If they can do it, you can do it.
I try to interact with all the children. Like Keyshawn in cabin 17. I was just in there cleaning his room. And for some reason, when I go in there and talk to him, he just be smiling. And that makes my day.
I've been here since 2002. I came in as a volunteer, and I enjoyed being here so much. It helped me get over my fear of working with children that were that had chronic illness. I didn't understand chronic illness, but I began to see Rabida as a special place. This place is phenomenal in what it provides for families and what it provides for patients, and the hope that it puts out there and the hope that it gives to people. And the staff here and the physicians here, everyone just kind of welcomed me on board that I'm still here. And it's been 10 years. I don't plan on going anywhere. And so that's my story, that where I thought that I was just volunteering my time and giving my love and support, they've given a lot back to me. And it is, it's priceless.